Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Speckle report. This audio podcast is part of a Heighe Bedlam. This audio podcast is part of a Bedlam Plexar, and this audio podcast is part of a Storm Robotics production. This audio podcast will go into or delve into looking at a sort of a viewpoint or a stance in around this peer-reviewed and published works from 2021. So to begin with, in the United Kingdom, for example, patient view or a sort of an EPR if you like, electronic patient record, referred to as patient view or PV, had perhaps been a pioneering example for patients or healthcare service had been a pioneering example for healthcare service users, wherein it serves as an EPR management system for healthcare service users and carers. PV was established in around 2004 and provided CKD healthcare service users access, for example, to test results and information or investigations and information about conditions and around the conditions. It had been available in most UK nephrology department divisions, up to around 75% of patient groups or healthcare service groups or healthcare service users sort of registered in some NHS National Health Service or NHS sites, and one team in around some published works highlighted how healthcare service users utilized PV over 4 years, and investigated factors that encouraged a greater level of encouraged a greater level of the interplay between PV use and sort of in line with for example nephrology appointments, for example. So at the time of the PV census, 11,352 patients or healthcare service users have been registered from 37 of the UK's 73 adult centres or NHS sites, and providing information to healthcare service users is or was unlikely to be enough to motivate self-management and improve outcomes without further care. APR access or electronic patient record access had many advantages, but healthcare service user enthusiasm and use had been variable. The more successful systems had provided information that healthcare service users need, and usually in the setting in around chronic illness, emergency or pertinence. Variation in uptake and use have been regarded to social factors, for example, and concerns have been expressed about sort of a digital divide. A digital divide and sort of the cost in regard to the use and health outcomes. EPRs like PV have been reported in several investigations over time, and while clinicians have reported that consultations with healthcare service users have changed because of access to EPRs, patients or healthcare service users can still have questions in regard to healthcare in regard to healthcare. So whilst clinicians have reported that consultations with healthcare service users have changed because of access to electronic patient records, healthcare service users still have questions. Still can have questions in between the times the times around service healthcare service in between the times around face-to-face healthcare service provision. So patients or healthcare service users tend to go through several distinct stages of healthcare around chronic kidney disease, the chronic kidney disease trajectory, and generally can require a differing level of healthcare and understanding. One team had informed how effective it can be for healthcare professionals to use online spaces for education, and to have the involvement of MDT and multidisciplinary teams, and proactive allied health professionals, or AHPs, tend to be at the forefront of accessing evidence-based practice frameworks and surrounding MDT around MDT, and uh, and so and so and so and so and so the, and so at the same time where varying MDT and AHPs allied health professionals where AHPs can utilize or have utilized the evidence-based works to ensure that patient care is not compromised. So that draws this audio podcast to a close. This audio podcast as part of a Speckle report, an audio podcast as part of a Heighe Bedlam, an audio podcast as part of a Bedlam Plexar, and an audio podcast as part of a Storm Lobostics production.